The American Cancer Society recently announced updates to its cervical cancer screening guidelines, including a new age to start screenings, new self-testing options, and additional guidance for when screenings can stop for older patients. January is Cervical Health Awareness Month. Cervical cancer is very treatable when caught early, yet half of all women diagnosed have never been screened or are not up to date on screenings, and more than half of all cervical cancer diagnoses are made beyond an early stage. Thanks for joining us for this week's Health News You Can Use. I'm Dan Cohen, and I'm joined by Dr. Nora Badner, a gynecologic oncologist at St. Luke's Cancer Institute. Dr. Badner, thanks for joining us today.
Thank you for having me.
Let's start with those new screening guidelines. What's the latest on self-screening for patients?
Absolutely. So the new guidelines last month do now include the recommendation for primary HPV testing. HPV is the virus that causes the majority of cervical cancer cases. We do still prefer clinician-collected cervical HPV testing, but one of the biggest updates is that self-collected vaginal HPV testing is acceptable. As long as these tests are negative, depending on what testing you have, we recommend repeat every 3 to 5 years, depending, and this should be discussed with your provider.
Dr. Badner, there are also age-related updates for screening. Can you walk us through what those are?
Absolutely. So those at average risk of cervical cancer should begin screening at age 25, which is a little bit older than the prior recommendation for age 21. And these should be performed every 3 to 5 years, depending on what type of screening you're undergoing. Those at higher risk, such as patients who are immunocompromised or patients with HIV, should start screening at the time of diagnosis, but no earlier than age 21. Every patient's journey is a little bit different.
And also, how about stopping screening? What do the age guidelines look for older patients in that area?
Yeah, so those at average risk of developing cervical cancer can stop screenings at age 65 if they have negative primary HPV or co-testing results at both age 60 and 65, or 3 consecutive negative cytology tests. But if patients have a history of abnormal pap smears, we do recommend screenings continue potentially beyond the menopausal age and even beyond age 65, depending on their medical history.
Now, in addition to those screening guideline changes, why is the HPV vaccine such an important component of prevention?
The HPV vaccine is the only cancer prevention vaccine that we have available. The earlier patients are vaccinated, the stronger the protection, and the HPV vaccine is very safe. This protects against 9 strains of HPV, which cause both cervical cancer and genital warts. And current guidance recommends either 2 or 3 doses of the vaccine, depending on your age at time of vaccination. This vaccination cadence can start as early as age 9, and we do recommend both boys and girls get vaccinated.
Really appreciate you saying that. On top of knowing screening guidelines and schedule, I want you to also talk about signs and symptoms. What should women know about those before they talk to their care team?
Absolutely. So regular screening is critical because cervical cancer may not initially cause symptoms, but as it grows, some symptoms patients may experience include bleeding after intercourse or bleeding between periods or postmenopausal bleeding. Patients should address any changes to their menstrual bleeding patterns, including heavier bleeding or bleeding in between the normal menstrual bleed with their care team, as well as any new or unexplained pelvic pain.
What does diagnosis and treatment of cervical cancer look like for a patient when they do receive that news?
So we'll initially start with a pelvic exam, and we do want to get a biopsy of some kind. This can sometimes be performed in the office or under anesthesia with a short procedure if needed. Once we have that diagnosis, we usually get some additional imaging to determine if the cancer has spread beyond the cervix. Early stage disease is sometimes still treated surgically, but this is limited to the very earliest stages of disease.
Sure.
And chemoradiation treatments or systemic chemotherapy are another part of the treatment puzzle. We also have new immunotherapy and antibody drug conjugate options, which are part of a very encouraging trend with improved survival and outcomes in cervical cancer.
Really appreciate you saying that. And as we wrap up, Dr. Badner, and recognize Cervical Health Awareness Month, what are some final thoughts that you have for our audience?
I think it's really important to emphasize that treatment for cervical cancer doesn't automatically mean menopause and hysterectomy. Fertility-preserving options are sometimes available, and this is especially important since cervical cancer often occurs in younger patients.
Sure.
It can't be overstated how important early and regular screening is, and data suggests that from the time of first infection with HPV until diagnosis of cervical cancer or development of cervical cancer, that can take about 10 years.
Sure.
So the earlier we detect it, the better prognosis, the better the treatment outcomes. Reproductive health can certainly be something that's very difficult to talk about.
Absolutely.
But that's what our care teams here at St. Luke's are for. You know, we're here to have open, honest informative conversations to determine the best treatment plan for each patient.
Well, Dr. Banner, that was a lot of great information you share with our audience, and we thank you again for joining us. We appreciate it.
Thank you for having me.
To make an appointment for a cervical cancer screening with a St. Luke's gynecologist, visit stlukeskc.org/gynecology. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.